Okay, so explain to me why healthcare is a right to an individual and not a privilege.
Thank you. Your question was, why is healthcare a right and not a privilege? Well, first of all, according to the United Nations Declaration of Human Rights, Article 25, Clause 1, everyone has the right to a standard of living adequate for health and well-being of himself and his family, including food, clothing, housing, and medical care, and necessary social services, and the right to security in the event of unemployment, sickness, disability, widowship, old age, or other lack of livelihood and circumstances beyond his control. Also, it's a right because everyone should have equal rights to live their life fully and live it to the best of their ability with the technology and advancements that the United States has made. So offering them an option would allow them to pay for that and be equal with all other citizens.
Protein, you say that healthcare is a right, but in your own words, your plan is not synonymous with universal healthcare. You spoke a lot in your speech about not wanting to leave anyone in the dust. How can you justify still leaving people in the dust if your plan does not entail universal healthcare in Indiana?
Thank you for your question. Your question was, how is it justifiable to leave consumers in the dust if the public option is not entailing universal health care? I answered you, public option will simply help lessen the gap that is not covered by Medicare and Medicaid to help people with affordable care. There would still be Medicaid for those who cannot afford the plan.
I'm wondering, you've argued with clarity about why you don't think that a public option is a good option to reform the healthcare system. However, Carly talked about how you're using the wrong tool, but I'm not really sure what other tool you're bringing up to exactly reform the healthcare system. You said it has problems, but is the only thing you want to do fix malpractice?
And your question was, what is our proposed resolution for an option if it's not a public option that we're describing? We are arguing for that the public option should not be instituted because public option does not offer individuals the rights that they deserve to have. We need to have a reform. Pardon. We need to fix what we already have. We don't need to make new problems. There are certain problems in place right now, such as individuals cannot pay for their insurance. Individuals are not, as they mentioned previously, individuals are not, they're not suited to pay for the injuries that they sustain. Injuries are
clearly given some examples of how you think the public option is not a suitable way to help healthcare. And you've mentioned ways that there would be reform, but you haven't given any very specific ideas that you maybe come up with. What specific options do you have to go with instead of just saying that public option should not be done because it'll make it worse? What have you thought of as an alternative?
We understand that there needs to be reform, and we just feel that the public option is not the right way to go about it because we understand we don't have a specific way yet. We know that something needs to happen. We know that something needs to change. But we're not saying that we have a specific plan. We need to come up with that plan. That's what we're saying. And that's why we're arguing that the public option is not the right way to go, because it's rushing into something that won't necessarily fix all the problems. And we're not saying that we have a specific way to fix the problems, but we don't need another option that will cause more problems than we already have.
ProStat has brought up that if we have a public option, we can pay for it by shifting funds that are allocated to Medicare and Medicaid right now into the public options. However, they have contradicted themselves. I would very much like the program to please explain how we can maintain both options if the people who do not wish public option are still going to be allowed to use Medicare and Medicaid.
Thank you for your question. You asked whether we would be able to maintain funds under both options. We would just like to stress that the public option is an option, and the people will be paying for the public option, not the government itself. Thank you.
What happens to the middle-class citizens as healthcare costs are rising and they find themselves financially stable but still unable to afford healthcare?
First of all, the same question could be asked if we go off of public option, that how they're going to pay for it. There's still going to be the group that's left out of the bunch as taxes are passed on. Instead of the lower income people being the ones left without insurance, it'll be the middle class who's forced to pay for others.